Thank you very much, Petra, for the nice introduction. It's always a pleasure to come by and visit you here in California, and especially if I'm able to come to this esteemed institute here. So I'm a clinical neurologist, and I dabble a little bit in some favorite things, and one of the favorite things was looking at wrinkling, but it's not the wrinkling like outside with the Botox. It's water immersion wrinkling, and that has a few certain characteristics of its own which are very, very distinctive, and I hope we'll be able to look at these together from the viewpoint that this is potentially a really cool test for testing your nerve fiber function. So your normal tests of nerve fiber function are generally nerve conduction, which is, there's a picture here, and intraepidermal nerve fiber density estimation, and you get the skin from a punch biopsy, and it's an invasive process. Those are basically the really two gold standard tests of peripheral nerves that are used in clinical everyday experience. So to say a little bit about the background of wrinkling, recently it's attracted quite a bit of attention from a slightly different point of view. Wrinkle fingers and toes gain traction as an adaptation against slipping. Those was featured in Nature and in the Washington Post. But I want to give a slightly different aspect. I want to take you into the physiology of how it actually works, so that we can together look at how this can be used as a test of nerve function. So there's a huge need for having a screening test of neuropathy. There is no screening test for neuropathy, in contrast to many other end organs. There's great retinal screening tests. You photograph, really simple, easy, fast, cheap. There's great kidney screening tests. Urine dipstick is a wonderful screening test. So there's no useful screening test for peripheral nerves, and this is the viewpoint we're coming in from, seeing whether it's going to fit in there and fill a slot, which has been which has never been filled really. So I'll try and take you a little bit to look at the background, what is known about skin wrinkling already, a little bit about physiology. We were very much involved in testing the physiology and finding out how it actually works, and then see, what can it be developed, and what are the points for it for going into the screening, and what are the problems, and then hopefully we'll have a Q&A session depending on how much time you have. So how do you define wrinkling? Well, it's the undulations occurring in digitips after 5 to 30 minutes immersion in water, and you have to keep your hands in the water the whole time. And then you get these wonderful wrinkles which are very easily discernible in normal individuals, and it's reversible. So let's look a little bit about what is known about the background of the wrinkling. And if you ask people, well, how does it happen? Most people will say, well, it's something to do with osmosis, isn't it? Because water and a semi-permeable membrane is always something to do with osmosis. And that's a reasonable thought. People always say, well, there's keratin swelling and waterlogging, and this makes an increase in volume, and then your finger starts bulging. Well, so we did a very simple test to see whether that could hold water or not. This here is volume. So we're measuring volume here against time. Your digit tip is the volume we're measuring. This is a fully wrinkled finger at this stage here, and this is the finger over time, over 1,800 seconds. And you see how the volume expands. It's about 40 microliters. So, in fact, you lose volume when you wrinkle. So this whole osmosis story crumbles and doesn't work, unfortunately. So let's look a bit further. How was this test then linked to nerve function? And it's
for us, sort of nerdy scientist types, how did you measure volume?
It was really hard. I couldn't do it on my own. I went to my engineering colleagues, and we built a machine especially for it. which was sensitive enough to measure your pulse volume change, which is about 5 microliters. Every time you pulse, your digit tip changes by about 5 microliters. And we then employed it over a wrinkle. And we had to start off with a wrinkle because you had to keep it in place. So we couldn't do it the other way around. That's why this graph is like the other way around.
Yeah. Was it a non-invasive technique?
Non-invasive, yes. Yeah, but it was a huge effort. It took like 2 years.
Really?
Yeah, I know. We're dumb. I'm sorry.
Those are very small volume changes. Getting those measurements precisely is...
It was a huge effort. You're right.
Did you
Yes.
think about 3D scanners?
No.
So
But I probably should have.
Yeah, those might actually work for the next time.
Yeah, that's cool. In fact, we were thinking of developing that as a measuring parameter of the nerve function then, the change in volume, but we encountered so many problems. We said, this is far too difficult for what is supposedly a screening test, which should be simple.
Yeah.
So therefore we discarded it. But we just did the proof of principle testing there. But afterwards we can maybe have that's. So what, as often, great discoveries are made by very serendipitous ways. And in 1935, these two doctors encountered a mum who came. A kid had fallen, cut the median nerve with a glass, very specifically, and noticed that when she bathed the kid, the median nerve innervated, skin did not wrinkle. So he thought it was very odd, and told the doctor, and they made a note of it and repaired the nerve, and afterwards the wrinkling came back again. So they thought, maybe that's something got to do with the median nerve injury, and hand surgeons traditionally use this to monitor digit nerve regeneration since, and have published quite a bit about it. And also noting that there's a correlation with regeneration of the nerves to the digits. But the breakthrough in understanding what actually happens came in 79, when people who went for treatment for palmar hyperhidrosis, which is this over sweatiness. 1% of the population has over sweaty hands, and they block the sympathetic nerve fibers here in the neck, and they become dry. And they noticed that these guys don't wrinkle anymore. So they thought, okay, so the missing link must be sympathetic nerve fibers. And since then it's known that skin wrinkling is an indicator of limb sympathetic dysfunction. That was a crucial link, knowing which nerve fibers are actually responsible for the wrinkling. But then, which kind of sympathetic nerve function is responsible? Nobody knew. And we started becoming interested in this because of its potential use as a screening test, and asked, well, there's not that many sympathetic functions in the upper limb. Most of sympathetic nerve function in the upper limb is vasoregulation. So we thought, well, start simple. We'll just check and see what happens with the vasoregulation during wrinkling. So we measured the skin surface capillaries with flux, with a very simple laser device, and we measured with ultrasound the digital and ulnar artery flow during wrinkling, just to see whether there were any vaso changes occurring. And to our surprise, wrinkling is accompanied by significant and consistent reduction in blood flow velocity. There's a maximal vasoconstriction in the digital vessels. And we then thought, well, if vasoconstriction is one of the thing's main proponents behind the wrinkling, well, applying a vasoconstriction should naturally generate wrinkling, shouldn't it? Should do. So we tested EMLA. You probably all know EMLA. That's the emulsified, the local anesthetic mixture, which is a strong vasoconstrictant, and could show that it induces skin wrinkling very similar to water immersion, and the accompanying vasoconstriction was nearly identical. So these are the results of the actual measurements pre, post, and this is your blood flow here on this axis, and this is water immersion, salt water immersion, this is EMLA, and this is aqueous cream, and you can see all of them a consistent, significant decrease, and this one has the least, just aqueous cream on its own. So, and this shows you that the wrinkling is actually very, very similar, only you can actually see a nice cut-off line here with the EMLA application, and so it makes it easier to read your change than in water immersion. So that is one of the bonuses of, but we'll talk about that later. So extending the thought behind the physiology is, if you can vasoconstrict and induce wrinkling, well, what about if you can block it? Does it block wrinkling? So this is my finger, and it was in the days when you didn't have to get ethical permission and everything. So this is my finger wrinkled, and my other one, injected with phentolamine, which is an alpha receptor blocker, so blocks all your adrenergic function. And this one was totally unwrinkable. I tried everything to make it wrinkle, but it totally failed. I swam in water for ages, and this was the only part of my body which was unwrinkled was that one I had injected with the phentolamine. And it's kind of a permanent blocker, so it took about a month to wear out. But now it wrinkles again. So that seemed to all fit in nicely with the theory behind how the sympathetic nervous system induces wrinkling in the digits. But then the next question is, well, why is it selective, this wrinkling? Why does it only occur in the hands and the feet? Because it, by definition, only occurs in the glabrous skin, so in the gripping parts of the skin, which is your palms and your soles. Your soles are much more difficult to interpret because of the keratin and because it gets pounded the whole time when you're walking, so you have a lot of mechanical damage down there the whole time. So we were thinking, well, what could be the reasons behind it? And some of the suggestions were, well, sweat glands, obviously, because somehow the skin probably gets penetrated, and the obvious penetration channels are your sweat pores. And if you look at it, in fact, your highest density of sweat glands in the body is, in fact, in the glabrous soles and the palms of your hands. It's extremely porous because of that. And there's also other glabrous skin areas without sweat glands, and that skin does not wrinkle. So we're thinking, well, sweat glands are probably very, very important in inducing or allowing this process to be induced. And we came up with this theory of trying to reduce the main components of wrinkling, and I'll just try and take you through it in this cartoon here. So if you start here, the main components we reduce to are glomus bodies. Glomus bodies are it's like a giant vascular ball, and they're in your digit tips, very specialized arteriovenous vessels. And we call them glomus bodies. So you have glomus bodies, you have a sweat gland, this is the gland, this is the duct, and if you take these and then you water immerse, so the water comes in, and what does it do to your electrolyte, your normal electrolyte concentration? It totally changes it, doesn't it? And around, this is your sweat gland. Around your sweat glands you have a very dense network of nerve fibers, sympathetic nerve fibers. I'll show you some pictures just in a while. And so the theory is that when you get this dilution of the electrolyte concentration, you change the firing rate of the nerves because they're dependent on the surrounding electrolyte concentration, and the blood vessels constrict. Now, what happens when you have huge amount of blood vessels constricting in the digit tip? So on your left, you see here, these are your sweat glands, and these are your glomus bodies here. And these glomus bodies are attached to the skin with a very dense collagen network. And so if these things start constricting, they pull the overlying skin downwards because of the negative pressure which develops inside, because you have a loss of volume inside your digit tip. This gets reduced by, I don't know, 50%, and so therefore something must take the place of the reduced volume, and it tugs down the skin above it. So likely the mechanism of water-induced vasoconstriction is a post-ganglionic vasoconstrictor axon. So those are the sympathetic nervous fibers we were talking about. It's also possible that it's mainly alpha receptor, but there could be other receptors involved as well. We postulated alpha receptors because of this test I showed you where with phentolamine being injected and preventing the wrinkling. This here is meant to show you the very tight anatomy between sweat ducts. Now the sweat ducts are these honeycombed. You see the white arrow indicated. You see this little honeycomb pattern in the background? That's a sweat duct going through your skin. This is a picture of your skin. The red is blood vessels. The green is nerve fibers. And you can see the nerve fibers are twirled around this, everywhere around the sweat gland. So just to show you the very close arrangement of sweat glands to nerve fibers, underlining the possible theory that it's due to this electrolyte change that induces the whole process of the wrinkling. So that's all I wanted to say so far for the physiology. Is there any queries on the physiologies before we go on to seeing, well, how can we use this as a nerve function test?
Think that the initial step after the diffusion of water from the sweat glands into the extraglandular, extracellular,
Yeah.
That precipitates a change in transmembrane potential.
Correct.
Which diminishes.
Changes the firing rate of the
Slow it down or speed it up?
So it'll be, because the sympathetic nerve fibers are tonically discharging, so it'll speed up the tonic discharging, thus vasoconstricting. It's like a stimulus. Most adrenergic, most outside stimuli are stimulating towards the sympathetic nervous system.
So why would there be vasoconstriction if there's more metabolic demand?
But there's no increased metabolic
More metabolic demand versus an increase in fire rate?
I don't think. I don't know. It's a good thought. I've never thought about that, but I don't know is the answer.
Maybe some more pieces of the puzzle are coming because did you test nerve fibers?
Yes, nerve fiber densities and stuff like that. That's coming. Yeah.
Okay, I'll keep watching.
Sure. Was there another question there? Or?
Well, if you put in your figure into a liquid that's the same sodium with potassium.
Yeah. So that's a good question. So your question is whether there's a change in the wrinkling dependent on the osmotic concentration in the fluid, and the answer is yes. And it's been tested which ones are the best for wrinkling and which ones are the worst. So concentration hugely changes your wrinkling. Yeah. As does temperature, as do a couple of other things as well. Yeah, good question though.
But wrinkling occurs in salt water and fresh water.
Correct. Yes. Yeah. So our current tests for nerve fiber quantification are histology, and this just shows you the principle behind a skin biopsy and how you then derive intraepithelial nerve fiber density, which is one of the gold standards for quantifying your your nerve index, if you would like to say. And this is just a normal picture here of normal nerve fibers taken from the sole of, taken from the palm of the hands. Can you see this little bead of pearls going up here? Up here? Maybe those sitting at the front can see it. Those are the intraepidermal nerve fibers, which go right to the surface of the skin. This one shows absent nerve fibers in the diabetic. And this is just an immunofluorescence showing you the same thing. You can see the fibers here, here, and then they branch off into the epidermis. So we were thinking, well, if this is really a nerve fiber test, one should be able to correlate it with the established gold tests. And we set out to do that. We correlated water immersion wrinkling to the intraepidermal nerve fiber density, and in a prospective study of polyneuropathy. And we found that when you measure it against the gold standard of intraepidermal nerve fiber density, wrinkling sensitivity is around 80%, specificity is 75% in being able to identify an abnormal intraepidermal nerve fiber count. Water wrinkling, we compared these two, pretty similar. It's sort of 70% sensitivity, 73%. Yeah, it's just a little bit less good than EMLA, but that's what you would expect because EMLA is so much easier to interpret and it probably gives you better vasoconstriction.
Is there a different time course for those lesions? Does it happen around?
It's exactly the same length of stimulation. So you have 30 minutes for the EMLA, and you have 30 minutes of immersion in a bucket.
Yeah. So the EMLA doesn't act any faster?
No. And it shouldn't do. But I think it's a more powerful stimulant, personally, but I don't have any good data to back it. And the interesting thing was the negative and the positive predictive values. So a positive predictive value of around 90%, 83 for water, are not bad for screening tests. So that was very encouraging for us. This is to show you how do we grade normal from abnormal wrinkling. And this is really where most of the development for a screening test will have to be concentrated in, because where do you put your cutoff is a big question. So there is a grading scale which is recognized, at least in the literature, and grade 0 is absent wrinkling, and that is very clearly something that is abnormal. Grade 1, you have slight wrinkling and the fingertip is not smooth. Grade 2, 2 or less lines of wrinkling on each side of the whorl. The whorl is this thing which is centered where your fingerprints are centered on. And then this step from grade 2 to grade 3 is where the cutoff is. 3 or more lines of wrinkling around. And this, of course, is the area where one would have to develop to increase sensitivity and specificity even more. But just based on this simple distinguishing marks, you arrive at the sensitivity and specificity I've showed you.
Is that standardized for salinity of the water, like
Yes.
temperature,
Yes.
duration of
Yes. All of that needs to be done, and that's a very good point. And that'll come along as to the biases and the influencing factors of wrinkling. You need to have a very standardized environment for that if you use water. If you use EMLA, you don't need to have all these other factors, which makes it a lot easier, and that's why we're very much interested in developing the EMLA device, because it's so much easier. The second thing was comparing not only against the intraepidermal nerve fiber density, but against the neurophysiological tests, which is basically the skin sympathetic response for sympathetic nerve fibers. There's no other test in the human which is based on a neurophysiological method. And so we set out to look at that as well. And we compared it in parallel with the epidermal nerve fiber density and the sympathetic skin response. And this is in a little bit bigger font, so you can read it easier. Gold standard was, again, intraepidermal nerve fiber density and the SSR. The 76% of abnormal wrinkling could identify an abnormal intraepidermal nerve fiber density. So it's very similar to the previous results, where it was around about 80%, 75%. Water wrinkling was very, very similar as well, 71%. But the disappointing thing was the performance of the sympathetic skin reflex. If you look at it against the intraepidermal nerve fiber density, it's as good as a flip of the coin, unfortunately. So that really disillusioned me about SSR. And although you'll still find it's one of the standard tests in the textbooks, it really does not perform that well if you compare it against the gold standard. So we were then thinking about how to best adapt as a clinical screening test. So basically it has to be very user-friendly, has to be very easy to interpret outcome measures, and one needs to then ultimately test it in a large prospective study. So this is the problem with water immersion wrinkling. Have you ever tried doing this for half an hour? It is not very comfortable, I tell you. Even at, and this thing here keeps the water at 40 degrees Celsius. So you have to have all these correction factors, and it becomes very uncomfortable here because it sort of you tend to lean your arm on it, and your median nerve gets all funny and everything. So we thought, well, let's simplify and just use the EMLA. And we've compared EMLA against water immersion wrinkling extensively in their qualities in reducing skin digit blood flow and in the measurement of wrinkling, in the inducement of the wrinkling. And they're very, very, very similar. So we thought, well, why not just simplify? So this is the method we are currently using. We just put EMLA at the digit tip, wrap it, and then wait for 30 minutes, and then afterwards we measure it. We, in fact, take digital photographs, pre and post, to make it as objective as possible. I think the interpretation of the outcome measures in the EMLA is so much easier, and I think you'll agree with me because you get this wonderful cut-off line where it shows you what the skin should really be like unwrinkled. The important point for taking digital photographs before the test is that we have, all of us, a natural degree of wrinkling present, especially as you get older, because you get tissue loss in your digit tips to a variable degree. So being able to show a dynamic component is what the important thing is there. And one thing we've already alluded to, that what are the important things to watch out for, because any test has its problems. And sympathetic function, of course, plugs into temperature. So temperature really has to be controlled for. You have to have an ambient temperature which is regulated at least. We usually measure this fingertip temperature to make sure that it's 30 or above. If it's below, you're going to have a certain degree of natural vasoconstriction below 30. If you're using fluids, you've got to look at the electrolyte composition. So there are standardized solutions and recommendations, but you have to make sure you just don't use your own tap water because it could be quite different. And as already mentioned, the volume of the digit tip is an issue. There could be atrophy, edema. And an important thing to remember nowadays, a lot of people put cream on their skin for whatever reason, and that could act as a barrier for the absorption of substances across. So we always make sure that 24 hours before, no skin creams are employed. Well, I just want to sort of show you what we're thinking of based on this background of how it can be used. The most important thing is, of course, having a big prospective trial, testing what you want it to work for. So we are currently in a big prospective study on diabetics, a blinded study, and it's a comparison against standard clinical and neurophysiological tests. And we've got a goal of 400 patients being prospectively recruited, and then being able to distinguish diabetics with and without neuropathy. Those are the outcome measures. And at the moment, we're just about to do our half-time interpretation, and things are looking quite interesting. It's sort of around 70%, 70 to 80% sensitivity, it seems to be. But I can't tell you more than that. So this is the ultimate goal, to have a test for nerve function similar to that of a urine dipstick test. And I'll leave it here for discussion with a picture of where I am at the moment on the sabbatical in Heidelberg. And please come by if you ever visit Heidelberg. It's a nice place, especially when the moon is out. And thank you so much for listening. I think we'll have a time of Q&A. Is that okay? Or